So if you are thinking of, if you're qualified as an endocrinologist, so the where to go is actually where the demand is maximum actually. So see, endocrinologists deal with lot of basically primary care things. Actually, much of what we do is almost can be done by a primary care physician. So a lot of doctors, and even opinion among doctors is very wide and varied actually. So you will see a lot of doctors who say that all patients have to be seen by a GP, and then they have to be referred to the specialist to do only specialized work like that. So that is something that's followed in UK and all that, which follows a socialized system of medicine actually, where the individual does not have the choice, but the doctor's services are contracted by the government and apportioned to the individual based on their need actually. So India is not like that. So in India we decide what we need actually. So if I want to, it's my money. So if I want to buy a motorcycle, I'll buy a motorcycle. If I want to buy a car, I buy a car. If I want to go on a holiday, I go on a holiday. I am a big libertarian, so I would not want to, want the state to tell me, whom I should meet actually. So because with the internet, all of us are educated and aware. I think most of our patients also know, what their disease is, and they have a right to choose basically. And likewise, doctors also practice changes actually. So there are different perspectives are there. So this perspective is my perspective actually. So I feel that if they go to a tier 2 or a tier 3 city, that's the best for them. I mean, in terms of, and but the thing is, they should have some entrepreneurial skills. They should, first of all, and there's a lot of learning material. Just go on YouTube, the same YouTube where we are on. So, and learn how to set up your own clinic, learn how to hire staff, learn how to have a Excel sheet, spreadsheet, manage your finances, hire a accountant, get your GST registration done, get your company registration done. So all this you can learn actually. I mean, these are not very difficult things. These are stuff that everyone should do, and legally anybody who runs a business should know basically. I mean, irrespective of your educational qualification, even if you are a 12th pass or a 10th pass, the law expects that you know all about all these things. So these are not beyond your grasp actually. I mean, it was beyond your grasp, it will not be the law actually. The laws are laid down democratically in our country, so it's not overwhelming. I mean, very often people tend to think that there's too much fuss, it's too complicated, I cannot learn like that. But that's not the case. I mean, if you're able to take the time and learn a little bit about all these things, I think you can set up your own practice, and that will improve your practice actually, improve outcomes for all patients. If you have your own small center in a tier 2 city and you're an endocrinologist providing high quality service, now the problem in healthcare in India is one of quality actually. Quantity wise, I think we'll be doctored up enough actually. It is just that the quality matters.